Hey, it's Dr. Schmidt. So I wanted to go over, in order of importance, the best labs for diabetes and heart disease. And it's actually pretty quick. And of course, the best diet for diabetes and heart disease. And so as I go through this, you may have to hit pause, write down notes, rewind it. Don't type in the comments, hey, what did you say about this other lab? Don't ask me in the comments. Just rewind the video. All right, so here we go. The number one most important lab test for your heart, for heart disease, is the coronary artery calcium score. And I have plenty of videos on that. You can search my name plus CAC or coronary artery calcium on YouTube. You'll see me talk about it. That's number one. Number two, most important lab test for your heart is actually 4 tests for clotting factors. And I'm going to say them right now: fibrinogen, homocysteine, lipoprotein A, and C-reactive protein, otherwise known as CRP. And there's, in the lab work, there is a high sensitive CRP and there's regular CRP. So you can get the high sensitive HSCRP, and it costs the same, but it's more focused on the heart. So I'm going to say those one more time: lipoprotein A, fibrinogen, homocysteine, and HSCRP, high sensitive CRP. So those 4 clotting factors are the second most important lab test to get run. The third one is your standard lipid panel, and that's cholesterol, meaning total cholesterol, LDL, HDL. And then you can get small, look for like small particles or big fluffy particles if you want to do that. They're not that necessary. And in that panel, then you also want triglycerides, and you also want VLDL. Now, a lot of labs won't run VLDL, although it's, in my opinion, the most important number of all of them. And your VLDL needs to be less than 18. And the next most important number in the lipid panel is your triglycerides. Your triglycerides need to be low, like less than 70. All right, just as a FYI, last time I ran mine 2 weeks ago was 43, and my VLDL was 9. And I've been eating low carb, high fat, high protein now for a year, but low carb for 20 years. Low carb, high fat for 20 years, moderate protein. Now, as another factor, my lipoprotein A was also 2.5 years ago, 131. It's supposed to be less than 75. Well, currently mine is 81. So I've dropped it 50 points in 2.5 years because of ketosis. And that includes a carnivore diet in the last year. When I say carnivore diet, my diet is 90% meat, right? My calories are 90% meat. Okay, just to recap, the 3 most important tests: number 1, the coronary artery calcium score; number 2, the 4 clotting factors; and number 3, the standard lipid panel with a big focus on VLDL, very low density lipoprotein, and triglycerides. Okay, now another thing related to heart disease is diabetes. Diabetes is a major cause of heart disease. And so your glucose is more important than your lipid panel and your CAC and all that for most people. All right, so let's talk about diabetes. Here are the 4 most important tests for diabetes. Number 1, in order of importance, number 1, ketones. When you're in ketosis, your diabetes is going away if you're type 2. And if you're in ketosis, your type 1 diabetes is getting under control. Okay, so that's number 1 for diabetes. Number 2 is insulin. You want your fasting insulin below 5. And if that's under control, then you know your blood sugars are under control. So let's talk about the last 2. Those are blood sugars. Number 3 then would be A1C. That's a long-term measurement of blood sugar and how much damage the sugar is doing to your arteries. And then number 4 is glucose, which is just a spotlight, just a real quick test of your blood sugar right then and there. And so let me repeat those. The top 4 tests for diabetes: number 1, ketones; number 2, insulin; number 3, A1C; and number 4 is glucose. And for most people, that is more important than any heart disease test. Now, there are people that have heart disease and they're not diabetic. And what that means is they have some sort of infection in their arteries causing calcification, or maybe they have some damage to their kidneys Okay, whatever. I'm not going to go any further than that. So let me give you one more concept about this. Then I'll talk a little bit about diet. So this concept is go wide, then go deep. So, when you have a heart issue and you think, oh my gosh, I feel unsettled here, my blood pressure is a little bit up, what is my diagnosis? That's not really the question to ask. When you're asking that question, it's like you're going deep. It's fine to ask, later, you do want to find out your diagnosis, but go wide first. And you look at your lifestyle and you look at your food choices and you look at your cooking oils, and you're cleaning up a whole bunch of things in your lifestyle. In the meantime, you get a diagnosis, you run a bunch of tests, you see if there's anything specific to address. And in the meantime, you should be getting better and better and better. And then by the time you actually get a diagnosis, maybe you're 50% better at that point than you were when you first realized you had to do something about it. So go wide, then go deep. I'm going to give you an example of a patient who, not my patient, another doctor that I know. And this patient was diagnosed with ALS, Lou Gehrig's disease. It's a horrible disease. So she went for a second opinion, and the second doctor said ALS, and the third doctor said ALS, and the fourth doctor said ALS, and finally she got a real second opinion, and she got a blood test done, and it was Lyme. So now she has this opportunity to get better. So there's an example of like, keep going and going deep. And if you're not happy with your first diagnosis, doesn't make sense to you, you're doing a bunch of research online, look again and again and again. And now this person that was initially diagnosed with ALS, now they have a chance because you can address the Lyme. Okay, let's talk about diet. In order of importance, ketosis, low carb. Okay, I should start first with low carb. Now, low carb means less than 75 grams a day. A very low carb diet means ketosis, like less than 20 grams a day. So we're going in order of importance here. Low carb encompasses a lot of different eating styles, but ketosis is very important, whether you have blockages of the arteries, whether you have high blood pressure, calcification in your arteries around this in the soft tissue. You got ketosis mobilizes the calcium, ketosis dissolves the fat. So ketosis is the most important diet. Now, the second thing to consider about this is that you need to eat red meat to feed your red meat that's pounding away in your chest. You got to feed this red meat some red meat. So there's the carnivore diet. So now looking back in my last several months, I think most people, and this is true for most people, I think that the majority of the calories of my patients is meat, and they're still eating some vegetables. And I think a lot of people jump into the carnivore diet and then they realize, oh, I miss my salad or I miss my asparagus or whatever. Fine. But the point is, the majority of their calories is still meat. And that's the fuel, that's energy, that's a high energy food. When you eat a whole bunch of produce, that is low energy food, it's low calorie food, and you're filling yourself up and you're not giving yourself room for the high energy food. That's what you want, is the high energy food. Okay. The vegan diet is a temporary cleaning diet, and it can make you feel lighter, and it can be a cleansing diet. It cleans the blood. It helps with a lot of plants. It can help clean the liver out. It's got, various plants have sulfur and methyl groups and other biochemistry that can help the cells in the liver clean the body out. But in the long run, it's not building. And if you have a heart disease issue, you have to build. If you have ketosis with red meat can build and clean at the same time. That's probably the biggest point. When you're doing a vegan diet, you're cleaning, but you're not building. So I put veganism at the very bottom of the rung, just above the standard American diet, which is the cause of modern chronic diseases. Okay, and I'm not, again, I don't, if you want to be vegan, go right ahead. It's your choice. Okay, so there's my thoughts on that. And let me give you an update on this finger. 10 stitches. I just had them removed 2 hours ago. And what I did was I walked into a room with the lights off, and there was a light switch, and the cover over that light switch was metal, and it was not flush with the wall. It was sticking out. So as I swiped my finger up, I just slid it right along the side of that metal light switch plate, and it just almost sliced the tip of my finger right off. So 10 stitches in the circle. And I mentioned in a video, I walked into the ER at midnight, and I walked out, and I didn't know what the price would be. And I was talking about the free market and insurance last video, and here it is 10 days later. It was a week ago in 2 days, so it was 12 days ago. I still don't know what my bill is, but anyways, I got these taken out today, and I paid $120, and I'm willing to pay that. And I got a big discount. I think it would have been $160 or $180, and she told me that I got this discount. Now, when you ask for a discount because you're paying cash, the most proper way to say it when you're talking to the person at the counter is you say, I'm paying now at the time of service. Is there a discount for that? That's the legal way to go about it, instead of saying, do you have a cash discount? And that's not the legal way to say it. So just keep that in your mind. You're paying for the service at the time of the visit, and you get a discount for that. So that's a little gem right there. It makes it easier for you to deal with the hospital system and the people that are taking your money. And there was the most incredible pain when she pulled out all these stitches, and there was one in particular, and she yanked on it and pulled it out, and I made a fist and I said, that hurt like hell. And then I did this, and then I broke out into a sweat, and then I felt I could hear the noises come in, and then I felt lightheaded, and I told her I'm lightheaded, and I had to lay down on my back, and then slowly I could hear the noises come back out, and then the sweating went away. I wasn't passed out, but I was almost there, and I drank the water. So I appreciate the nurse that pulled these stitches out to deal with that BS, the human body, that vasovagal response. Okay, so that's all I wanted to say. And what I want to do is I'll do a live video soon, hopefully this week. And then Thursday, I jump on a plane. I go to Dr. Berg's keto conference. And that'll be a lot of fun. And I'll talk with some of my favorite people, including Ivor Cummins will be there, and Ben Bickman. Of course, I'll chat with Berg. And sorry, I'm not going to get to your questions, but I'm going to read through these, and I'll catch up with what you have to say and what you have to ask. And I can use those for future ideas for videos. All right. Thanks for watching.